Kaki Georgi, thank you so much for being with us and following us with the checkpoints. You guys, as a members of the council, following the details of the vaccination plan. I mean, the action plan itself, which is transparent and open for the society. Uh, what kind of challenges do you face as the most significant and worst to mention? So, could you be so kind to identify those challenges for us and for the viewers of the checkpoints? Georgi, let's begin from your or Kaki, as you wish, guys.
Georgi, please.
Georgi,
please, Georgi.
Okay, thank you for giving me the first. Thanks for inviting, and I'll try to be brief about the challenges because challenges are huge. The first is we do observe the inequity in vaccine distribution around the globe. So although the aspirational declarations were there and the institutions like COVAX Fund have been created, but unfortunately, the recent developments over the past 4 weeks do reveal that these aspirational declarations for time being are not upheld. So the first challenge for Georgia would be to make sure that it would, not only for Georgia, but for many countries outside of the high-income ones, so would be to secure the sufficient equal doses that supposedly should belong to their proportional to their population. The second challenge that I see is that the whole volatility of the system, the environment in which the vaccines are being approved, authorized by national regulators, because this is a completely volatile environment, which is to a degree predictable thanks to the World Health Organization and also others involved in information dissemination. But most importantly, the most challenging part is the production capacity, for which I don't think the world has a clear handle, or if there is a clear handle on the production capabilities and how they could evolve over the coming months, that has been honestly and fairly and truthfully communicated to the rest of the world. So,
while transferring my next questions to Kaki, Georgi, do you consider one of the most challengeable as well the execution itself of all the plan and all the actions?
I was getting there because the vaccine deployment plan, preparedness, also depends on the type of vaccines you would receive. Would that be ultra cold chain? Would that be Moderna, that requires -20, or that would be a kind of 2-8 degrees, so more of a regular cold chain requirement? So preparedness plans are also faced with this kind of uncertainty, and they have to be adjusted. Luckily, countries could probably do a proper job, but based on the consultations with my colleagues and discussions that I have, so it's not easy because it requires a kind of you are dealing with completely different trainings for the staff that have to administer these resources, these vaccines, and importantly, the scale is huge. The scale of the vaccine administration is not comparable to the ones that countries are being used. So you have to completely remodel your health system, rescale your health system, increase its processing capacity 4 to 5 times or 6 times, and also introduce the complexity of the cold chain management. So the actual delivery is as complex as any other issues that I've mentioned. I'll stop here and over to Kaki.
Georgi, thank you. I'll be back quite soon. Kaki, I liked your quote in regards that it's world faces the countries worldwide face sort of third world war in regards of competition for having vaccine doses in the countries. We are a part of the same race, and also we are part of the COVAX platform. Besides challenges and besides being a part of the working group under the Georgian government working on the action plan of the vaccination and challenges you will mention, could you be more specific about the appropriate dates and amounts and volumes of the doses Georgia might realistically expect during 2021?
Greetings, George. Greetings to our listeners. And first of all, I would say that the challenge of this, the biggest challenge, as was mentioned, is really an implementation of this plan. And multi-sectoral nature or multi-sectoral effort that is required to implement this plan would require a major effort in terms of very effective coordination and supervision. So that's I would consider to be the biggest challenge and constraint that we may face in that. The second is the communication campaign, because that we have about 41% of our population either hesitant or refusing to vaccinate, and about 70% in addition also are hesitant to receive the vaccine. And also we have 50% of the population, most part of which are not eligible in the beginning for the first 6 months to be vaccinated, because for the first 6 months the plan envisions, as in many other countries, only vaccinating or mostly vaccinating the so-called priority high-risk groups, which are the medical personnel, which are the aged, the institutionalized personnel, also the population aged over 65 and 75. So this is, and the expectation and management of those that are not in the line for vaccinations for the first 6 months will be a major challenge, because it may discredit the whole process if this part of the population tries to use their connections in the government or elsewhere to try to jump the line, in other words. I mean, and that might be a problem with credibility. So it's a double challenge of expectation management and double challenge of increasing demand for vaccination. For the first 6 months, to be realistic, we have secured up to 210,000 doses of Pfizer and AstraZeneca vaccines, which will be enough to vaccinate around 80,000 people, not more than that, which will cover probably the first risk group, which is the medical personnel, and maybe some of the the aged population, like population age over 75.
Oh, okay.
And that's also as a challenge to convincing them to vaccinate. But beyond that, in the first half of the year, we would expect that this will be realistic amounts that we receive from the COVAX platform. But there are two possible additional sources that we hope that Georgia might be successful to negotiate diplomatic through channels, through bilateral negotiations with the manufacturers, but more likely with European Union and the United States as our strategic partners, that they could allocate some of their quotas that they had secured over what is required for their populations, if all the manufacturers will come true on their promises in terms of amounts manufactured, and as well WHO provides, or other stringent regulators provide authorization for those vaccines, of new vaccines that are up to 20 of them are now in the clinical trial phase 3, which means a large-scale clinical trial. So,
in regards of COVAX, it's how much, if it's going to be realistic till 2021, it might cover population from 20 to 23%. Am I right?
Yes, that's right. I mean, 23% of our population is the commitment, is initial advanced commitment taken by the COVAX, but guaranteed from that amount, which is about 1,400,000 doses, which is 23%, which require 1,400,000 doses of vaccines for 700,000 people approximately. But this is only 23%. We have to find somewhere another 36% vaccines for another 60%, 36% of the population before the end of the year, if we want to achieve the ambitious goal, which is ambitious as it is because, I mean, reopening the economy is the vital for this country. So, and the full reopening of the economy cannot happen without 60 to 70% of our population vaccinated. Before you achieve this community immunity, it is impossible to open the economy in a full scale. and that would require another 36% to be procured from somewhere. So that's our biggest challenge as well, and we need to finalize that before, let's say, December 10th in the ideal scenario, which would mean that in the 6 months from June to December 10th, you need to vaccinate more than 1 million people. So that is a major challenge that would require quadrupling basically the existing capacity of immunization and creating, absolutely, as George pointed out, new capacities like huge vaccination centers, and as in UK or in Israel, and with its logistics, with its lining, advanced booking, and advanced events monitoring, and all the mobilization of people from the far remote areas and hard to reach areas, bringing people to vaccination points, and so on and so on, as quadrillion logistical challenges.
Kaki and George, while talking about the immunity, I followed. I cannot call those researches, but is it so simple or simplified calculation for the immunity of the Georgian population that we can add those who are vaccinated already? Let us consider that some population is already vaccinated. Can we just add those who already suffered from COVID-19, recovered, and can we consider that it's a portion of, like, 20% of our population? And can we consider that we vaccinated 23%? And can we just automatically add another 20 who already suffered from COVID-19? Yeah, it's
tricky question.
Yeah, it's a tricky, but at the same time, we need to find some answers in this quite authentic myth and legends going around. Kaki, go ahead, and then I will follow George in this regard.
Just quickly, I would say that when we're talking about the 60% to be vaccinated, we're also assuming that about 20% will have, let's say, the post-disease immunity. Yeah. In addition to that, so 80% total population, which, for routine vaccines, we usually are looking at 95%, for example, for measles, we want, and for any other vaccines, the ideal coverage targets are 95%. So when we say that based on the epidemiological models, when you have 60, that's why we're saying 60 to 70, right? Depending on what will be the portion of the population that will have a sustainable immunity by that time, because we don't know yet whether this immunity lasts over 6 months, or we know that that antibodies are not that durable, because they are after 3 months going to decline. But we know that we have the so-called cell immunity kicking in, which is like T cells, B cells, and the other cells that are active in protecting the body in our wonderful and remarkable immune system. And but we don't know how stable this immunity is. While for vaccines, we already know, for example, that Moderna is claiming that their vaccine, for example, has at least 1 year of immunity. We may hope that, depending on the severity of the disease, there are also accounts that immunity depends on how severe the symptoms and clinical manifestation of the disease was in a concrete individual. And if it's more severe disease, we're claiming, some research claims that have resulted in more sustainable immunity. But we don't know, but there are many unknowns too there. What we know is that we need to have 60%. We need to have a minimum of 60% of our population having vaccinated in order to be able to confidently open the economy. So that's the point at this stage.
Thank you, Kaki. Georgi, please go ahead. Floor is yours.
Thank you, Georgi. So I don't know how much I could add what Kaki said. So first of all, it's probably beyond my expertise bandwidth, as well as my mental capacity, so to kind of contemplate. I just see the logistical challenge there, because with many things unknown or evolving, in a global science with regards to the duration of the immunity and immune response, compounded with the logistical challenges of denying somebody that had already been infected from immunization. So those two taken together, I don't know like where we would land beyond saying that our target should be at least to vaccinate 60% of our population. So what exactly that would deliver in terms of immune collective immunity, so in terms of to prevent the transmission. So luckily, like what we're hearing, depending on the vaccine type, so the vaccines not only kind of reduce the severity of the disease or the odds of contracting disease, but they also reduce the transmission possibility. So that's very positive development, because so far we only knew that they are reducing the infection severity as well as the odds of being infected. But now understanding that even if you're infected and you are vaccinated, so the odds of transmitting to somebody is reduced. So probably we're getting in a different environment in terms of scientific data, which could tell us better what the optimal coverage amount with the vaccine should be in order to create the
Immunity.
Collective immunity. Yes, but as I've said, so there are so many unknowns. Let's take for time being and let's get to 60% before the end of 2021.
So we know that 60% immunity will stop the transmission. That's clear. Second thing we know so far, there will be zero death if you are vaccinated as a result of COVID. There will be zero death if you are vaccinated. You have a zero chance of death if you are vaccinated as a result of COVID. Again, both in terms of if you are vaccinated, there are no deaths recorded related to the vaccination, but also there is zero deaths after 100 million people, more than 100 million people are vaccinated in the world, and hundreds of thousands of people participated in trials before that. What we can say with confidence, which is not transmitted as a message through media, is that there is so far zero chance that even if you contract the disease after the vaccination, that you die from this disease. That's, I think, the key message that should be transmitted to everybody.
That's what we're going to do and proceed. Thank you so much, Georgi and Akaki, for your time and for being with us. So good luck and stay safe. Thank you.
We are BMG. Follow and subscribe for business and economics news.